I watched a black man get lynched in the street, and there are some people that don't agree that it was wrong. And I began to weep.
It is wearying on one soul that the experience of being a black person in America is witnessed on the screen, almost like tragic racial injustice pornography.
What I noticed about what changed in 2020, COVID really became the great revealer of decades and decades of disinvestment, as well as structural racism that has plagued the south and west sides of Chicago for generations.
It's not that we are seeing more racial injustice. It's that it's being recorded. And now individuals are able to see what we have been talking about for over a century. The experience of people of color is radically different than other people in this nation. And now it's forcing us to have a conversation.
Welcome to Our Chicago Black Voices of Change. I'm Cheryl Burton.
And I'm Jose Sanders. We bring it to you from a place that is a beacon of hope on the South Side, the new Chatham Education and Workforce Center. We'll have more of that just a little bit later.
It's been a tumultuous year since our last Black History Month special. Across the nation, we've seen racial unrest and protests for justice, all the while the pandemic taking a devastating toll on our community.
Well, during this special month, we must talk about how we got here, where we are now, and shine a light on the people leading the way toward change.
So let's start by rewinding almost a year ago when Chicago landed in the national spotlight with one of the very first known cases of COVID-19.
We had a call that a person had been in Wuhan, China, and had just returned and was ill.
In January 2020, Dr. Linwood Jones of Amita St. Alexius in Hoffman Estates became one of America's first medical professionals to see the ravages of COVID-19 for himself.
When something comes up that you don't know about. And so we had to learn fast.
Dr. Jones' patient and her husband recovered. But now, so many months later, tens of thousands in Illinois have died. Like Patricia Friesen, the state's first COVID-19 related fatality. Then, just 10 days later, after Patricia passed, her sister Wanda also died from the disease.
The numbers are real, and so it is real.
Those numbers are also very real to George Miller. He is the CEO of Loretto Hospital in Chicago's Austin neighborhood. In fact, this predominantly African-American neighborhood was deemed an early COVID-19 hotspot by Governor J.B. Pritzker.
What COVID has shined a light on is the fact that twice the number of African Americans have been adversely hit with the COVID virus.
And for African Americans in Chicago, this disease has brought a disproportionate death toll too. Here is a breakdown by race. In the city, black residents are dying from COVID-19 at a rate that is more than double that of white Chicagoans. The Loretto Hospital opened these testing tents to try and stem the tide of COVID-19.
We think that's an important, if we're going to help eradicate.
It hit the African American community first really, really hard.
The glaring disparities at the root of these statistics came as no shock to Tanisha Jones.
While it didn't sit well with me, it was a space to move into action.
And action is why her nonprofit, Westside United, launched 2 years ago. It's the brainchild of Rush University Medical Center that brought together multiple medical institutions and community groups.
We were created to start to mitigate some of these things way before the pandemic. There's a 14-year life expectancy gap between the West Side and the Loop.
So, Westside United set out to close that gap by 50% in the next decade. Last spring, Mayor Lightfoot tapped Jones and Westside United to begin to wage a war on COVID-19 with the city's Racial Equity Rapid Response Team.
This is a different way, sort of like a test of what government and nonprofits can do together.
And next up, their big push for vaccination. That massive undertaking is actually playing out all across the city. It put Loretto Hospital in the spotlight more than a month ago.
These folks are the lucky ones to get us started.
We were the first in Chicago and all of Illinois to have that done. It was a very exciting day, historic.
Barbara Shields Johnson oversees 45 nurses here at Loretto Hospital, including ones who treat patients in the COVID-19 unit. She was ready and willing to get the vaccine and became Illinois' second recipient.
When this came along, I want this protection for myself so that I don't contract.
Vaccine is what we have now. I think we all have to band together and trust a little more.
That trust is very difficult for some. According to a Kaiser Family Foundation poll done late last year, 35% of black adults surveyed said they would probably or definitely decline the COVID-19 vaccine.
Hell no, I'm not going to take it. Not at all.
I don't want to be like a test dummy for it.
I feel like you take the shot, you get sick.
Dr. Jones acknowledges the infamous Tuskegee Project that misled the black participants and knowingly deprived them of proper syphilis treatment is likely fueling these notions.
I think that this is one of the bases for mistrust of the medical community.
Back at Loretto Hospital, many doctors and nurses will continue fighting the good fight.
We still got another 6 months to go, and our team members are burnt out.
But he is still hopeful that the light shone on these sad disparities will force real and lasting change.
We got to change that narrative. It does not need to be that way.
Coming up, see how Chicago's black churches are helping combat hunger and provide healing.
Hey, if you like that video, be sure to subscribe to our ABC7 Chicago YouTube channel.